Today, I'm pleased to announce that our government will be investing a further $222 million over the next 3 years to increase access to harm reduction services and addiction treatment in every region of the province.
Ontario's Minister of Health pledging $220 million over the next 3 years towards battling the opioid crisis. Includes adding more frontline harm reduction workers, increasing the supply of naloxone, expanding needle exchange programs, and supervised injection sites. Well, also at that news conference today, volunteers behind that pop-up safe injection tent in Moss Park, they asked the minister to remove some of the red tape that makes it possible to set up interim sites like this one, but also the one in the park. And here's his response.
I don't have the ability to provide a legal exemption. I don't believe anybody at the provincial, it's federal legislation. What I can say is I understand the frustration by those who are not only operating but accessing those services in that matter.
So we wanted to know just how easy or difficult is it to set up a sanctioned site like the one here at 277 Victoria. It turns out you have to submit quite the application to Health Canada. In terms of all of Toronto, only 4 applications have been submitted. That includes the ones that have been approved, the 3 permanent sites that are in downtown, the east and west ends, but also the pop-up or the interim site here at 277 Victoria. Now let me read off of some of the things that are required if you want to submit an application. You need to submit site plans, also recommended numbers of the potential users, stats on how it impact crime, the number of drug-related overdoses in the area, and also required are a financial plan, a staffing list and criminal background checks, a letter from the Minister of Health, and a report on how the community consultations went. And all of that is way too much red tape for the folks who set up that pop-up tent in Moss Park in a matter of days.
We want more of these across the city, and people want them across the province. We're hearing from people from all over the province who are asking us how to open them up. They want rooms as well. They want them where people are dying and where people are overdosing. In BC, they gave a ministerial order. We wanted that here in Ontario. They're saying that they can't do it. We're asking them to work with the federal government.
And just to give you some updated numbers, Toronto Public Health says a total of 53 people have used this interim site here at 277 Victoria since it began last Monday. Now, Health Canada says anyone can really apply to set up a sanctioned safe injection site. However, if you kind of look at the history of everyone who's applied across the country, it usually involves public health authorities like Toronto Public Health or community centres that already have health care related services on site.